The procedure that we've adopted is a combination of what Emory University Hospital and University of Nebraska have adopted as their personal protective equipment. What we'll be having Dr. Cleveman wear is actually well above and beyond the CDC recommendation. It's important to know that the Ebola virus is not an airborne virus. We are using airborne level protective equipment. The reason for this is because if it's airtight, it's liquid tight. We know that contamination by blood or other bodily fluids is actually how the exposure to Ebola happens. So not to confuse people that there's any worry about airborne Ebola, really what it is it's easier to get something liquid tight if we know it's already airtight. So the first thing that we're asking our providers to do is to get rid of everything that's on their personal attire that doesn't need to be there. Things like their badges. Most patients that we're going to see in this situation are suspect Ebola cases that will later be ruled out. Ebola is still very rare. We're mostly doing this on levels of preparedness to make sure that we don't have any last-minute scrambles. Once that Ebola has been ruled out, he'll be able to have his equipment back. And you'll see we've had him change out into generic hospital-issued scrubs so that his own street clothes are not put at risk either. We're going to start with one layer of a surgical gown. These gowns are liquid impervious, and you'll see that we have multiple layers of these gowns being put on just to make sure that no liquids or bodily fluids find their way past the outer layer. In addition to the 3 layers of outerwear, we also have 2 layers of impermeable footwear. These gloves are the inner gloves and will remain until he's all the way back out of the patient room. What you see here is the first layer of protection, and so this is technically going to be a clean layer for the most part, having been under another outer layer. We decided that the layering was really very important, so multiple layers, even though probably one layer would have been sufficient.